All right, it's time to continue acknowledging Women's Month and some incredible women here in South Africa. So we're speaking to inspiring women who are making a difference in their various fields of interest. Dr. Keorapetse Tabane, the first black medical oncologist to qualify in the country, joins us now to explain how she achieved her position as well as how education empowers women in the fight against cancer. What a pleasure to have you on the show, Dr. Tabane, and welcome to Morning Live.
Morning, and thank you for inviting me.
It's an absolute pleasure. I mean, you know, what we've been trying to do throughout the month of August is profile some inspiring women that have just achieved things that, you know, create heroes for the young girls that are trying to also come up and find their space in this world. So you are one of them, and we acknowledge you for that. And congratulations on becoming the first black medical oncologist in the country.
Thank you, Leanne.
Yeah, I mean, what was it like for you? You know, one would think, you know, in this day and age, sitting in 2020, that we would already have a host of black medical oncologists, and yet that's not the case.
So in fact, we do, because I mean, I qualified as a medical oncologist already in 2008. And so thankfully, in the last 12 years, there have been more young, dynamic people coming on board to make this place a little less lonely.
Yeah, good. I'm happy to hear that. So this was in 2008 that you qualified, and obviously you've been there.
Correct.
Working in the field, but you know, this is still a very, very difficult field to get into, and I mean, this takes a lot of work. From your side, the challenges that you faced trying to navigate these uncharted waters, what were they?
You know, I think, you know, it does take quite a while to qualify as a medical oncologist, but I must be honest that it doesn't feel long, because you don't really set out on your career thinking that you're going to be a subspecialist. You know, you initially just think you want to be a doctor, and then obviously things evolve, you know, interests evolve. I think for me, the challenges that I faced were people looking a little bit nervous to be treated for such a serious illness by a young woman. I mean, you can imagine that 12 years ago I looked a lot younger and than I do now. So I think, you know, just the acceptance of people trusting that you've got the necessary skill set to assist them and to perform. That was the challenge that I needed to work hard and prove myself. I needed to invest in myself, to learn more, to know that I'm on top, you know, of my game, and I'm able to support patients in a way that they need to in a very difficult time in their lives.
Yeah, and it really is a very, very difficult time in anybody's life to be firstly getting a cancer diagnosis and then having to go through the experience. It's very difficult. And yet, at the end of the day, there's often, and we look back in the past, there are many people that, you know, had to go to specialist doctors who were not from their respective communities. I mean, there were often times when doctors and patients couldn't understand each other and didn't see eye to eye on the treatment. This gap between culture and doctors in the medical field, how has it evolved, and what's it been like for you?
I think the key is to recognize that and to learn and listen. You know, the first few encounters are really about listening to a patient and to who they are, not just what's wrong with them. And that helps to set the path to clearer communication, understanding where they're coming from, and really asking an important question in as far as their goals are concerned. What do they want to see happen? Who are they, and what's important to them? You know, you can't know that without listening. So for me, bridging that gap has really been about listening before speaking. To make sure that I understand the context of the varying people, because of course people's journeys are different. You know, people want different things for themselves and ensconced in their cultural beliefs and their communities. So for me, it's really about listening first and then speaking after, and speaking less and listening more.
Yeah. You know, we look at cancer and research basically showing that it's set to become the leading cause of death in the 21st century, with as I say, research agencies warning that 1 in 6 women may be at risk of developing cancer during their lifetime. Now, we know that vulnerable women in communities may not get access to sufficient medical treatment until it's too late. What do we need to do to change this? And I imagine one of the starting points is education.
Absolutely. And, we cannot emphasize this enough, and it's really about being body aware, being self-aware, and being educated about it, being informed about it. We need to see that information gets to people who really do need to hear it, in rural communities, and also not postponing getting help for a symptom. But at the end of the day, the key thing is education. The key thing is awareness of self and of information.
Yeah, but I mean, if you can perhaps talk to us about the prevalence of cancer among women in South Africa, and specifically in Black communities. You mentioned rural communities as well.
So the difficulty that we have, unfortunately, in our country is that our stats are not up to date.
Yeah.
Our registry is not up to date. So then it becomes a bit difficult to quantify exactly what is the prevalence, especially in rural communities. Because also remember that our registry is pathology based, which means that the pathologists need to report the diagnosis of cancer. Now, bear in mind, in rural communities where access is an issue, you're going to struggle to first make the diagnosis, have a biopsy, get it into a lab where the pathologist can then report it to the registry. So those are the gaps in terms of actually determining how often and what the prevalence of cancers, especially in those communities. But that being said, we still know that we are seeing lots and lots of women presenting, particularly with late presentation, because of lack of access to screening. So we see that the difference between urban and rural women is that whereas urban women can present even with pre-cancerous changes, rural women tend to present with locally and distant advanced disease because of access, one, to information, but also difficulty of accessing screening, given the fact that our healthcare systems are already overburdened with a lot of lifestyle and communicable diseases. And so screening, unfortunately, tends to take a backseat because of the other competing challenges that we face in our healthcare system.
I mean, I want to talk about screening and how that's taken a backseat, because I know, speaking from experience, I went last week. I did the usual mammogram, and a lot of the ladies that were working there told me they dead. Nobody's going in. Everybody's too scared to go in and go for those usual medical checkups for fear of getting infected with coronavirus. But at the same time, the bigger fear of a cancer diagnosis that is being ignored is a reality. So, I mean, are you noticing that as well? Is that people are steering clear of their usual annual checkups and going in and trying to get that early diagnosis because they're just too worried?
Yes, absolutely. Firstly, congratulations to you for going, because the concern is that post-COVID, the next wave that we will have is the wave of undiagnosed and poorly managed chronic conditions, because people are deferring that screening and self-care for later for fear of contracting COVID. And so we once got to balance, the risks. Most of facilities are really putting in the effort to keep the spaces clean, to make sure that we distance, to do a lot more virtual discussions and so forth. So really one would encourage women, if they've got access to screening, to not defer the screening, because COVID will pass. But the next wave that really will be dealing with is advanced disease, unmanaged chronic diseases, which is also, a big concern into the future. So absolutely, we are also seeing that numbers are dropping. People don't want to come out, but I really would encourage people to actually continue to do their screening, so that we can avoid, incurable and manageable diseases in the future.
Yeah, no, I mean, I hear your words. I really, really do. And I have to tell you, it was an intervention on my side. It wasn't something that I deserve any credit for, because it was an intervention as well. Somebody said to me, and that someone was my mom, you're going you're coming with me, we're going together. But this is the reality is that, you know, sometimes you don't take this seriously, and you need to take this seriously. And I'm not only referring to women, I'm referring to men as well, because this is a lifetime sentence if you do not catch it early. And that's, I think, what you're trying to advocate for here, is if you start and you look at it every single year, you always do your self-medication examinations and whatever else, you can save your own life.
Yeah, I think I do understand, you know, that there is an element of fear of not wanting to know. We all go through that. But in the end, we've got to say, would I rather know now and be treated effectively, or not know and struggle to find effective curative treatment? So yes, we understand it's frightening. And sometimes ignorance is bliss, but not for long. It's not a good long-term solution to not know, because you know. So I think we need to overcome the fear of knowing, and do the screening and hopefully find things early. There is a lot of people who have been treated for cancer who are well. Because they did not ignore symptoms, they went for their screening, and so in as much as we worry that you know, cancer, you know, is a sentence. It's not if we find it early and we treat it. There are a lot of survivors, a lot of people who've done well, gotten back to their lives because they screened and because they did not ignore worrisome symptoms.
Dr. Tabane, just as a closing note, I mean, it's so refreshing speaking to you to get, and I do say it, the female side of oncology, and it is comfortable. It's comfortable for a woman to be speaking to you, and I say that maybe from a very subjective point of view, but this is inspiring, and I imagine if you have a word of advice to aspiring female oncologists out there that think, I don't know if I want to go in this direction, maybe this isn't the right avenue, what would you say to them? How do you inspire them?
You know, I would say, you know, to anyone who really would be interested in this space, you know, it's very exciting being in oncology in this era. There's a lot of new developments. Really a lot of big advances. So it's really a very exciting space from an innovation point of view. You know, so I would really say, you know, as long as you love it, the truth is that whatever you choose to do, you've got to enjoy doing it, given the amount of time you spend doing it. So if you think that you love science and you love caring for people, then this is definitely something to consider.
Let's leave it there for this morning. Pleasure speaking to you, Dr. Keorapetse Tabane, the first black medical oncologist to qualify in the country. That was in 2008, but talking to us about her journey of achievement, and as well as how education empowers women in the fight against cancer. All right, such a beautiful interview there. Sakina, lovely notes to leave the show on.